Let's talk to my next guest, Paul Krauss in the house. Grand Rapids this nonprofit and counseling leader is urging parents to learn mental health warning signs in kids and teens. Coming off of Kelly Peel's conversation, let's dig a little deeper on behalf of Health for Life Counseling. Good morning, Paul.
Good morning, Shelley. Thanks for having me.
Yeah, kind of a health theme somewhat on this morning. On many mornings. We'll speak on the topic of suicide tomorrow. Important to discuss. Why do I say that?
Well, basically, it's one of the worst outcomes that can happen to children and teens, and so I'm glad you're talking about that tomorrow. But many times, suicide and other mental health concerns are very preventable with many things that parents can do at home or helping teachers in the school as well.
Thank you. Talk to me about you, Health for Life counselor. How do you spend your day?
How do I spend my day? Well, we are a counseling office that specializes in trauma-informed care and EMDR therapy in particular, but we have a particular department where we are working with children, teenagers, young adults, and their families, and we actually also have group therapy and things like that as well. So I spend my time sort of supervising therapists and seeing clients myself as well.
Are there concerns about youth mental health that are continuing to rise nationally and across West Michigan, Paul?
Yes. According to the CDC, there is a dramatic uptick in anxiety and depression and mood disorders that's continuing since 2020. And many children are not even getting help if they even have a diagnosis. But in our field, what we're trying to do is prevent teens and children from getting diagnosis in the first place. So maybe when something's going wrong, having the parent try their approach, the community approach, and then counseling as a preventative item so that we can stop these issues before they turn into a long-term issue.
Yes. With our time together, Paul, I want you to discuss some of these major trends that may impact children's well-being. You want to start with the first talking point, please?
Yeah, I mean, we're not exactly totally sure where to point the finger about why anxiety and depression are up among children, but you can sort of see that the environment that we are living in is more stressful. That's also been confirmed by multiple studies. Parents are stressed, and that means you're going to get stressed children. The pace of life has sped up. Smartphones, social media, screens are everywhere, and we know through research that's just coming out through researcher Jonathan Haidt that excessive use of those things is actually rewiring children's brains in a way that didn't happen to their parents exactly because they're using them younger and younger. Thus, exposure to political turmoil, war, strange things they find on the internet, political dysfunction, and sort of an us versus them mentality, which can lead to more behavioral issues. So there's a variety of issues going on, and it's a lot for parents to contend with, but there are some ways to go about it that are less reactive and more proactive.
Yes. You say if there is a rise in behavioral challenges at school and home, avoid the label of problem child?
Yes, oftentimes, unfortunately, through our profession years ago, we would focus on the identified patient, which means there's a child acting out or a teen acting out and the family's really upset about it. And so the psychologists and therapists back in the 80s, really, and maybe even the 90s, used to say, okay, we'll focus on that problem child, right, that identified problem. What we've learned through research and, 30 or 40 years of this work is that in these situations, almost always there is a family and community component that needs to be addressed because children are influenced by their environment much more than adults. Their brains are looking for guidance, structure, parental or guardian or mentors and role models to model their behavior after. And so when they're acting out, we're actually seeing a cry for help. Now, help for what? Not sure. But we have to remember when we have a behaviorally acting out child, we need to get everybody in that child's life involved in the counseling or the therapy or the school intervention. It's not just about that child because that negative problem child label, they will grab right onto that because children are searching for their identity. Who am I? Am I a problem? If I'm a problem, I'm going to act like a problem.
Yes. What about this confusion between behavioral problems and normal development?
Well, this is a tough one, and this is where I think we all need a little bit of knowledge. There's many books on this you can read about childhood development, Dr. Dan Siegel wrote a book called The Whole Brain Child and things like that. But a lot of the things is like this. We've never been parents before. It's your first, second, third kid. This is the first time you've been parents, even with this child. And there's a lot of behavioral and developmental issues that go on as a child grows from year to year and rapidly changes as they grow that can look very problematic, such as behavioral outbursts, sometimes declining grades, extreme mood swings when they're teenagers, weird sleep disturbances. And what we want to be careful on the other end is that we don't also label those, oh, they have a mental illness immediately. No, let's come get that assessed. Let's try to figure out what the root cause of this is. And maybe sometimes it's normal development, and there's some things parents and teachers can do to tweak some of their strategies for working with that kid. And every kid's unique. Some kids are visual learners, some are auditory, some have, they have an ability to see things that we can't. Some, become very nervous and anxious. So we have to be able to find more out about that kid before we just say, oh, you're a behavioral problem child. It could be normal development, and we need to maybe adjust.
Paul Krauss in the house, Health for Life Counseling is Home Away from Home, also violencepreventionhotline.org, a source for you. A couple more on our list. What about these age-old issues of peer pressure, drug and alcohol exposure?
Well, I think the hard part that parents face is their little child is most likely, according to statistics, going to at least experiment with these things or be around these things, unless you're really kind of locking them in your house. They're going to take risks. That's part of development. So the hard part is this. A lot of parents want to drive into their child's head, don't do these things. They're bad things. Look at what happens to these people. Look at these people in jail. Look at these people on these reality shows and these rehab shows. That is not the way. I mean, that's a good lesson, but if that's your only lesson, that's it. You're setting up a philosophical debate. So I tell parents, if children have opinions about these things, like I think drugs are cool, I think alcohol's cool, I think these different celebrities are cool that are doing this stuff, don't argue with them about that. You can say, you're allowed to have an opinion in my house. Okay. However, in my house, these are my boundaries and these are my rules. So those things won't be happening in my house, but you're allowed to talk about it. And what happens there is you don't set up that paradoxical effect of a philosophical battle of viewpoints in the home. What's more important is the relationship with the mom and the dad or whoever is caring for the child, maybe the grandparent, to have a open and honest discussion about those things. So when the kid brings them up, don't go on with the lectures. Most kids know these things are not good for them. They do, but they want to experiment. They're excited. Oh, they have that egocentrism. It won't happen to me, right? So we want to protect them behaviorally, not enable it all. We want to make sure you know where your kids are. You want to make sure they're not around kids using drugs and alcohol as much as possible, but you don't need to argue with them about those items.
Thank you. Lastly, you touched on this, phones, technology, the anxious generation here.
Well, Jonathan Haidt, his book is a bestseller right now, and he talks about excessive smartphone and social media use. And here's the issue here. We just kind of threw these in children's hands without researching what could happen, okay? And we see with adults, lots of adults pick up their phones over 150 times a day.
Yeah, I've done it 10 times while you've been here.
Right. And so that in itself showing that adults have an issue. In fact, when you have a phone on your table, it's harder for you to read a book. It's harder for you to stay functioning. So just imagine me who did not grow up with a phone. It's easier for me to get off my habit. But if a child grew up with a phone, it's wiring them to say, this is your source of information, not this book. This is more exciting than going and playing outside. And that's why parents have to have limits. No phones in the bedrooms after dark. I would prefer that you use the parenting apps where your child gets an hour or so of phone a day and be monitoring who they're chatting with. It's not their phone yet. They're not 18. And letting that stuff into your home, they have unlimited access to the worst things you can possibly imagine on their phone.
Yeah. Lastly, does prevention start with education and action, Paul?
Yes, I believe that parents need to have support and education so that they can take action before these things become problems. I have a free downloadable guide at our website, Health for Life Counseling, and it's called Understanding the Levels of Mental Health Care Available to Children and Adolescents. And in that guide, I not only talk about treatment, but I talk about 7 or 8 other things parents can do at home before getting to treatment, such as getting your kids into pro-social activities, finding positive peers, and things like that.
Your passion is obvious. Thank you for serving our future. One more time, that website is, Paul?
That is healthforlifegr.com, or just Google Health for Life Counseling.
Right, keep up the good work, the necessary work, and these conversations with as many outlets as you can. Take care, Paul.
Thanks, Shelley.